that we environmental health officers take over from the Ministry of Health, Ghana Health Service, as barrier team in the local government service, for that matter, the MMD, Metropolitan Municipal and District Assemblies. Some of the challenges that we are facing are: one, we lack logistics. When I say logistics, I mean vehicle. Motorbikes, even computers, for us to be able to store data on this COVID has been a challenge. Some of us don't even have offices in our sub-district zones. We go there to the communities, engage the communities, and we come home. We come home just like that. This COVID, as you can see, and your comments can take, we use private heads from St. Dominic's Hospital, which shouldn't be so, because the Public Health Act, Section 3, has mandated environmental health officers to stop vehicles traveling in or traveling from an infected area. This is the case that environmental health officers don't have even the private heads nor a vehicle to convey the COVID dead bodies to the final disposal site, that's the cemetery, making the work very difficult for us to do.
Okay.
Operators. When environmental health officers and sanitation units of practitioners contact them and indicate that we want to use their heads for conveyance of the COVID-19 dead bodies, they shun away. They shun away from it. They are not willing to carry such bodies simply because of the infectious nature of the bodies. When the private heads from St. Dominic's is not available, since it is a hospital, we are able to convince them, use it and disinfect. When the St. Dominic's Hospital's heads is not unavailable, we are resort to use here that carries tomatoes, cabbages, plantain from these villages to Accra. That's what we use. We normally sometimes use aboboya. Since we don't want the body to stay in the morgue for more than 72 hours, as stated by WHO, because the bodies are not embalmed in the morgue. They are put in the body bag just like that in the fridges. So they will be there without embalming. They start to decompose slowly. Although they are in the fridge, they will start to decompose slowly, posing health risk to the environmental health officers who will be carrying such dead bodies, such infectious COVID-19 dead bodies. So this has been the challenge for environmental health officers. We are risking our lives. Per the Public Health Act, Section 172, it has immunity and indemnity. From this, per the standard, we are supposed to subject ourselves to medical examination after burying such infectious body. But we don't, because we are under local government, for that matter, the local government service. Nobody cares about us. But we are the preventive side. We are the public health law enforcement agents. We stand in per section 56 of the Criminal Procedure Code. That's Criminal and Other Offences Act, Act 30. Section 56 mandates environmental health officers to prosecute all sanitary and the MMDA's offenses, those sanitary IGF defaulters and co. We stand in as prosecutors. There's a section EI4 that of 1976. That's the appointment of public prosecutors. Enacted in 1976. EI4 mandates environmental health officers from senior environmental health officer upwards to be the prosecutor of the assembly. And we prosecute all assembly cases. So we don't see the reason why government shouldn't resource us to be at the preventive side, more than the creative. Because we are lower middle income country. We are a developing country. We don't have the funds. So why don't government look to the preventive aspect of medicine than the curative medicine? Because since the money are not there, we should be able to prevent some of the diseases than to cure for the diseases. The people, currently, the people in this country, some people in this country disbelieve that there is COVID-19 in this country. As I stand here with my team of environmental health officers, we have been able to take delivery of 10 corpses from the Ministry of Ghana Health Service, for that matter, St. Dominic's Hospital. We buried 10. COVID-19 is still there. It is on. It is infecting people. Protect yourself by going through the hygiene protocols. You wash your hands, you observe social distance, you observe physical distance when you are in a group, you wear your nose mask. Whoever is not wearing nose masks, we suggest that government should put environmental health officers to use. We are mandated by all the laws I have mentioned to discharge our duties with immunity per the section 172 of the Public Health Act 2012, Act 851, to discharge our duties with immunity and indemnity clause. So we are urging all environmental health officers around this country, all members of Environmental Health Officers Alliance Ghana, to continue discharging their willful duties. For that, the executives of Akwatia GH, that's Environmental Health Officers Alliance Ghana, in short, Akwatia GH, is also moving on to engage government to do the needed things in providing some logistics to discharge our mandate very well in protecting public health and safety in this country, Ghana.